Hey, everybody, welcome to the While We Still Can pod. Nice to have you here this week. We have a special guest. I'm so excited to welcome Dr. Gil Wilshire from Missouri Fertility. And he's a buddy of ours. We see him every week. And he is a reproductive endocrinologist, helps people achieve their fertility and family dreams and goals, and has for what, Gil? Well over a decade or
Oh,
two.
oh boy, I graduated fellowship in 94. So that's close to,
Mm-hmm.
boy, is that 30 years?
Getting there,
Yeah,
yeah.
that's
Yeah,
30
30
years.
years.
Yeah.
Yeah. It feels like what, 10 minutes? Yeah.
Oh, yeah, yeah. I know. Life is short, man. Blink your eyes, and it's just
Mm.
amazing how fast it goes. Uh, like Pink Floyd said, every day is getting shorter. Never seem to find the time. Yeah.
Wow.
And then you find 10 years have got behind you. No one told you when to run. You missed the starting gun. All right, Cam, there
Uh,
you go.
Okay.
There you
uh,
go. Pink Floyd, Dark Side of the Moon. There you go.
so
Get it out.
Yeah.
just to let people know kind of what your training means in layman's terms. So you did a gynecology residency.
Yep, OBGYN. So I did
Mm-hmm.
medical school, did a full
Mm-hmm.
4 year residency in OBGYN, and then did a 2 year fellowship after that in reproductive endocrinology. So I had to get board eligible and board certified in OBGYN and then board certified in reproductive endocrinology. So a little bit of both. Yeah.
Cool.
I don't
And
deliver babies though. We take care of pregnancy
yeah,
in the first trimester, but I don't deliver babies, which is considered
right.
obstetrics.
I see. Okay. And
Yeah.
so you've just helped thousands of people achieve pregnancy. Thousands and
Thousand.
thousands. That's
Two or
incredible.
three, two or three a week is what we
Wow.
average. 2 or 3 people leave pregnant and babies come back every
Oh,
week.
that's
Yeah.
fantastic.
Whoa. That's
So
crazy.
yeah, so that kind of brings us to the reason we're speaking is we're just curious from your perspective, that literally your livelihood might be in jeopardy if the way the political climate and the laws if they continue to go the way they are. Can you tell us in like a nonpartisan, objective fashion what that means to the community?
Oh boy, that's a big question. Um, in vitro fertilization means in glass, and in glass, in vitro in Latin means in the lab. So that's where the word comes from. And it means we're fertilizing eggs in the lab and creating little early embryos. And those embryos are then used to achieve pregnancies. And the process of IVF overcomes a lot of problems. It was originally invented for women with blocked or damaged fallopian tubes, but now it's used for many, many more reasons. It's used for male factor infertility, as long as guys need to have millions and millions of sperm unless we're doing IVF. And in that case, we only need one sperm per egg. So we can do IVF with a handful of sperm. So we can help men with fertility problems. Couples with male factor is called. Um, Still works for women with blocked fallopian tubes. It's also used for women with abnormal eggs who are making a lot of embryos that are incompatible with life. So there's many, many different reasons to do IVF, and it's essential. There are people with virtually no chance of pregnancy without IVF. So the ability to legally do what we do is absolutely crucial. Yes, to my livelihood, but to the as you alluded to the dreams of millions of people who wish to have babies, but otherwise would not be able to have them if it were not for IVF.
Yeah.
I don't know if that answers the question. It was a big question, so there's a
Yeah. It
focused
absolutely does.
answer. Um,
Yeah.
I think then you asked where's the things are going politically. It's hard to say. Um, I don't think there's much of an appetite to outlaw IVF. I think there's some people, a small minority of people, who do wish to do so. Um, but boy, I don't know enough about the politics, and every state is its own fiefdom.
Right.
As people may know, in the United States, every state has its own licensing. Like Lisa, if Lisa and I want to have do surgery in Illinois, we got to be fully licensed in Illinois. It's so from there's no national laws right now, so it comes down to a hodgepodge of state edicts and laws and peculiarities.
So I had a question. When the Supreme Court overturned Roe, did that trigger you to be worried about these sort of like the legality of what you're doing? And
Yeah, it raised
because,
questions. In fact, our phones, you can kind of gauge, you know, how important is it by how often do the phones start ringing when Dodd was overturned. When Roe was overturned. I'm not a legal expert here. I think it was called the Dodd case. Um, our phones started ringing and people started getting worried about, well, gee, what is the status of my embryos? Are my embryos safe? Should I move them to a different state or whatnot? So people start extrapolating where they see this potentially going, whether it's justified or not in actual, codified laws, or whether people just kind of, you know, you feel the wind, which way is the wind blowing? Well, certainly people started becoming fearful whether it could affect the status of their embryos. I mean, they're planning on having a family with or additional children with their embryos, so they were concerned. I of course had some concern. I try not to worry too much about things that are beyond my control. I'm not perfect at it, but as I get older, I just try to focus on the next thing at hand.
Yeah. If you
Certainly
figure that out,
raised,
let us know.
yeah,
yeah.
yeah, I'm
Yeah.
not perfect. I'm getting better at 63. I'm getting better. But certainly it raised fears and concerns. So when IVF is being discussed on TV or the radio, I pay close attention.
Yeah. Well, would you say it's true that a lot of times the way the laws are written, the way the bills are written, there is a space of just sheer ignorance about how these things work. And so
Oh,
a
yeah,
bill that maybe is intended for one purpose pulls in other things out of almost mistake. I'm sure, like you say, there's a subset of people that recognize that, life begins with the junction of the egg and the sperm.
well, I
But,
would take issue with that, but go ahead.
right.
Yeah. We
But,
do too.
Go ahead.
yeah, yeah. But even if you didn't, the way some of the bills are written, unfortunately, other things get roped in too.
Yeah, there's unintended consequences, and some of it comes down to pure ignorance of the biology of pregnancy, biology of reproduction, and
The first time I really took to heart that issue was a few years ago in Ohio. There was a bill introduced that would require an ectopic pregnancy be implanted into the uterus at the
yeah,
time of
right,
treatment. And, folks that have medical training realize that that's just absolutely impossible. You can't do
yeah,
that. That's
you
not how
can't
it
do it.
works.
Like
But
it was a couple hundred years ago, they tried to legislate the value of pi. The pi is the ratio of the circumference of a circle to its diameter. And they said, well, it's 3.14. We declare it so, and it's not. It just is. So that we have a history in this country of laws that are just technically impossible. They don't even what to call it. They're falsehoods trying to get codified. So yeah, so they said, "Oh, just transfer the ectopic back to the uterus." And I said, "Well, if you know how to do it, I would love to learn.
To
If you
learn.
know that, please, I and thousands of other OBGYNs would like to learn how to do that. Please show us." So yeah, it's an impossibility. It has no basis in reality. And so when they make laws about this, it's truly infuriating when things like this do come about.
right, right.
Yeah.
So I had a question about so when you implant the embryo
It's called a
and
transfer. It's called an embryo transfer. And then the
embryo.
embryo implants itself. So we transfer an embryo into the inside of the uterus, and God willing, it implants itself. Okay.
Okay, so sometimes it doesn't or they will get pregnant and then they miscarry.
Yeah, frequently.
Okay, so what I don't have you run into any issues with your patients with not being able to be treated while they're miscarrying? Because the law in Missouri, you know, there if the mother's life is in danger, but it doesn't tell us exactly what that is. So women
Yeah,
are bleeding out in the parking lot or,
yeah, yeah. Missouri, I believe, and I may be paraphrasing, with the definition of a viable pregnancy is a heartbeat in the uterus. Okay, and it seems simple. At least in my day-to-day life, I have not had to yet deal with a woman bleeding to death from a miscarriage where there still was a heartbeat. Mercifully, and now I have had. I'll talk about some very gut-wrenching, difficult decisions we've had to make. Slightly different situation, but so far, every woman having a miscarriage has not had a heartbeat. So I have not felt restricted in my ability to give the appropriate care to the woman to prevent hemorrhage and prevent infection, etc. But there are other situations that we should talk about where it's not so clear cut.
Yeah.
Where it is terrifying to try to give medical care, but it's not. At least Missouri is not as bad as Texas. In Texas, I believe, I don't know who it is, whether it's the Attorney General of Texas or whatever, but they have said that they're going to go after doctors providing this type of care. And I haven't heard that here in Missouri. The prosecutors don't seem to be as gung ho to prosecute doctors just doing their job.
Yeah.
good.
Well, and there's a lot of gray area there too with a heartbeat, because is it accurate to say that, a very young fetus or an embryo can have electrical activity present, but no functional circulatory system, no meaningful movement of blood? You know what I mean?
The problem is it's a continuum. It's
Yeah.
a continuum. And
Yeah.
I spoke about this on a radio show when the Alabama ruling came down. That was hot. It's like where does a river start and where does a river end? River begins a little trickle up somewhere, and somewhere it comes together and becomes a little creek and becomes a little river and becomes a big river. And where does it end? Well, it dumps into the ocean somewhere in this area, right? Well,
Right.
as life develops, it's not black and white. And it's going through an incredible process, a miraculous process. And people want to turn this process into black and white,
Right.
life or not. And we
It's
know
impossible. Can't do it.
it's just not life. And
Yeah.
you can do it with a rope. You can put a knot in a rope and say, where's the knot start? Right? Well, it starts
Right.
here, but now all of a sudden there is no start of the knot. It's and life is like that as well. Um,
Well, I would be really interested to hear those examples you have of just
okay,
tough decisions that most
Story
folks never
time,
think about.
story time.
Yeah.
these are the things that have added to my gray hairs. And first, you got to understand that, and looking even at general OBGYNs, it is incredibly stressful just doing the job. If you look at OBGYNs taking care of pregnant women, sometimes they get high blood pressure, severe life-threatening high blood pressure, and the fetus is around 22 weeks. They agonize. Thank goodness I don't have to make these types of decisions. They agonize. Well, when do we deliver this woman? Do you partition the risk to the fetus in prematurity or the woman who's about to have a stroke in the intensive care unit? These are terribly difficult decisions where there is no black and white right answer. Now, in my world, where I'm dealing with early pregnancy, I have had to personally deal with some of the following things. One is I have a woman in early pregnancy. There's a fetus, good looking little fetus in the uterus. Everything looks great. yet her ovary is twisting and dying. It's called an ovarian torsion. We stimulate pregnancy. Sometimes the ovary gets big. We've generated extra eggs. The ovary is twisting. She's writhing in pain. She's literally screaming in pain. And the treatment is surgery to untwist the ovary or take the ovary out. Well, what happens if you put her to sleep and you kill the pregnancy from the anesthesia or the procedure? What do you do? And I've got the husband there saying, do something, and the wife saying, do something. And I remember having to pull the trigger and say, please God, may, and I did it in 24 minutes. Everybody was ready, we put her to sleep, and then boom, I did what I had to do in the surgery and give extra progesterone and pray like really hard, and thank goodness that didn't disturb the pregnancy. But can you imagine if the pregnancy had died or miscarried? What would be my responsibility?
Right.
Terrifying. Also, you had mentioned ectopic pregnancy. 97% of ectopics are in the fallopian tube. What about the other 3%? Where are they?
What about them? And when you do thousands of these, 3%'s quite a fair amount,
Yeah, and remember, I'm dealing with women with fertility problems. They have damaged anatomy. We're putting embryos in a uterus that's had C-sections and surgeries and all that kind of stuff. And I'll just show you for those that can see this visually here. Let me see if I can show this up. Here's a diagram of a uterus.
That's great.
With the tubes coming off. And do you see this right here? This is a tunnel from the inside of the uterus into the tube coming outside of the uterus. This is a skinny little tunnel. It's in the uterus, but not in the cavity.
Right.
Yeah, like where does the knot start?
Right, where does the knot start? Where does the river start, right? I have had at least twice a pregnancy. They're all happy. The couple's happy. We put in an embryo. We do a scan. And if you had done a quick scan or just had a tech do this, do a scan, there's the uterus, there's the sac, there's the pregnancy, there's the heartbeat. You say, hey, Mr. and Mrs. Smith, look at this beautiful pregnancy you had. But if you look closer, you see the cavity of the uterus is empty and the sac is in the wall of the uterus in this little piece of interstitial tube. It's called an interstitial ectopic.
Oh my God, what do you do with that?
It's terrifying. I mean, my heart is in my throat right now. Because an interstitial ectopic, when that bursts, a woman can bleed to death like in minutes, okay? It's life-threatening. But what if it's 2 millimeters closer to the inside? There are cases.
Yeah, we're talking less than an eighth of an inch.
Right, yeah, millimeter, just a little bit. What if it's 2 millimeters here? What if it's 2 millimeters here? These can be called, the old-fashioned name is a cornual pregnancy. We can argue about definitions, but there are cases where it's just close enough to the cavity that it'll kind of grow into the cavity and the uterus won't explode.
Oh, so you had to decide if it was that.
So I had to decide, am I 1 millimeter this way or 1 millimeter that way from saving her life or going to jail?
Wow. If anyone wonders why we lay awake at night worrying, there you go.
Oh, and I'm responsible for this woman's life, and it's a tragic event. And so what did I do? Well, I did the ultrasound myself for a long time. I'm looking at it, making little measurements, bringing in my other colleagues. What do you think? What do you think? And there's various criteria. When it's in the interstitial part of the tube, it's very thin. It's in the muscle of the uterus, but on the outside, it's very thin. I looked at it, and I looked at it, and I looked at it. I said, look, this is interstitial. It's in the wall of the uterus. She's in pain. It could burst any time. Yeah. I said, look, if it was my wife, I would operate in take the ectopic out of the uterus. So I did. And I put a telescope, during the surgery, I put a telescope in the uterus and took lots of pictures to say, look, it's not in the uterus. Look, here's my pictures.
Yeah, here's the
Right.
Then I
proof.
put the laparoscope in the belly,
Yeah.
and here was this purple thing swelling out of the uterus, the blood vessels all dilated.
Yeah.
You could see it was going to burst. So I took lots of pictures of that. Look, it's going to burst. You know, I'm covering myself.
Well, and objective data in that scenario is key because that's all you have to make your decision with.
All I had. So, and these things can be very bloody. So lots of tricks. I've been doing this for many years. So I was able to remove the ectopic and repair the uterus, and she didn't lose any significant blood, and we saved her life. But what if I had looked in the uterus first and it was kind of bulging into the cavity? You know, so these are the unintended consequences, okay?
Yeah.
Doing our best to take care of people. We want people to have babies. We want to protect everyone's life, but we are put, unfortunately, into these terrifying situations that you mentioned, Lisa, are unintended consequences maybe of these laws. They don't know. The person drafting this law doesn't know that there are such things as interstitial ectopic. You can also get them in the cervix. You can have an ectopic pregnancy in a C-section scar. A couple of years ago, we had twins in a C-section scar. So it's in the uterus, it has a heartbeat, but it's about ready to rupture and burst into her bladder and just
Well, and
oh my gosh.
for folks that haven't had to spend any time thinking about this stuff, like when we do a C-section, which I've done in the past, not so much anymore, but boy, that uterus wall is so thin. Sometimes you can see right through it.
Sometimes especially if she's had a previous C-section, there's just a membrane, and the baby's waving at you there. You can actually see it through the window.
That is a very vascular tissue. If that just ruptures, then you've got big problems real fast. And Tina, I don't want to.
I know.
I don't want to reveal too much about Tina that she doesn't want, but Tina almost died having her baby.
You can really bleed to death. You can
bleed to death. You can bleed so fast you can hear it. It's called audible bleeding. And talk about terrifying. You can hear that type of bleeding. It is so loud. I don't even want to go into it. There's only two fields of medicine with audible bleeding: obstetrics and trauma.
Yeah.
Maybe vascular. Yeah.
Vascular, or somebody shot. And anyway, so it's a terrifying situation.
Well, I don't trigger warning because it's going to get a little more detailed here, but when a person has an ectopic rupture, there's a lot of blood in the belly, right, Gil? There's like a couple. 2 liters is not unheard of by any means.
No, I've had to go into a belly field, and you're literally scooping out handfuls and handfuls and handfuls.
Right, and that blood is somewhat clotted. It's not like
clotted and separated.
Chunky.
And some politician wants you to find a thing that's, the size of a pea or smaller, and that's kind of where we're at.
In training, I had a woman bleeding to death. She was wheeled into the emergency room, screaming on a stretcher, and this was before we had the ultrasounds. And a pregnant woman screaming in pain, holding her belly, has a disaster going on. So we just went straight to the operating room, put her to sleep. That was in the days before we were good at scopes. I remember I had to open her belly with a big incision. It's called a laparotomy. And the blood just starts pouring. Her belly's full of blood, so I'm scooping out the blood, scooping out the blood, scooping out the blood. I scoop it out, and there's a little baby in my hand. It was already dead. It was connected to an umbilical cord. It had grown in the tube, and then it had ruptured and died. There was already a formed fetus in my hand. I will never forget it as long as I live. Connected to a little umbilical cord going to her tube. Her tube was filled with placenta. It was like a sausage filled with placenta. And it had ruptured, it had grown into her belly and ruptured. What are you going to do? The woman
But
lived. Oh, the woman lived.
yeah, she's
Very
lucky
good.
to have lived, and there's nothing
She
you
was
can do.
dying.
Yeah,
She was bleeding to death, and
yeah.
we barely saved her life.
And
Um,
that's the thing, I don't know if people realize how pregnancy's
Dangerous.
not a benign situation. Yeah, when it goes
it's
perfectly
not a
well.
benign situation.
Yeah.
In the old days, Lisa, 1 out of 5 women, the old days, 1 out of 5 women would die from a pregnancy complication,
Mm.
infected miscarriage, a stuck baby, postpartum infection, something. Death rate was horrendous. And then every few decades, the maternal mortality would go down and down and down. And right now in the United States, I think it runs around 3 in 10,000 with
I see.
modern medical care. So it's not 1 in 5. It's not 20%.
Yeah.
Well, anyway, the percentage just every few decades with advances in maternal care and obstetrics, surgery, blood transfusion technology, and whatnot. Yeah, it's down to 3 in 10,000 on average. Unless you're black in America, and it's 3 times higher than that for death.
Right.
Whole nother
Yep. And it depends, I
controversy
think, what
handle.
part of the country you're in too, doesn't it? Some states have
Big
wildly,
part, but even in
yeah.
even in more upper class urban areas,
Mm.
the black women still have a higher rate of death, and the reason for that is interesting. It's a different subject. Maybe it's a different thing. We'll talk
Yeah.
about
We
it
want to hear
different
it.
time.
Yeah.
Um,
We could talk about Serena Williams had an experience.
exactly,
Yeah,
exactly.
and
This came up during the Olympics. Some of the women had
mm,
horrendous obstetrical experiences, and these are bright, articulate, well-to-do, famous women, who still seem to have a higher rate of
yeah.
complications. But anyway, but that's different. So that's different from these beginning of life decisions, which are clearly impacted by the
Right.
laws, and for which the laws that exist are wholly inadequate, and protections for the doctors who are doing their darndest
Under difficult circumstances
under
at best.
difficult, stressful
Yeah.
situations and emergencies too at times, um, really are doing their best. So another unintended consequence is the stress on the doctors.
Yeah.
Or people not doing it anymore, or leaving
Right.
the states that the laws are so ridiculous that they can go practice somewhere else. Why would they stay?
Yeah, I think Idaho right now is having the darndest time getting any OBGYNs to come
Yeah.
to Boise right now.
Well,
It's
they're
really, really
actually
slow.
helicoptering women out if they're like in a situation where they can't find the beginning or the ending, and they're like, okay, we can't do anything for you right now, but you're going to need it really soon, so you need to, and they will helicopter them out to a different state.
They'll go to Seattle. Yeah, from Idaho, they'll go to Seattle.
And
So
that's
Yeah.
what women, half of the population in the world, that's what you're going to like, that's what we're doing to them. I don't get it.
it's I think some people mean well, but they don't. Like Jesus said,
Understand.
forgive them; they know not what they do. You
Yeah.
know. Um,
They just don't
But
get
they
it. They
won't
don't, they don't
learn. But
understand.
they won't. But we have like the information that you can get in the world right now. I'm sorry you don't have an excuse, but I don't want to
Yeah.
hate people, so
Well, and spend a little time on TikTok, and you'll see how woefully uninformed a lot of people are just about basic female anatomy.
oh
right.
yeah. I love to ask the boys at work if a girl can pee with a tampon in. I'm
Well,
not
I
kidding.
know this, and
Spoiler
anyway,
alert.
the average guys don't know. The average
Yeah.
guys don't
Yeah.
know.
All right.
Now, another thing that I have had to deal with is I remember helping I don't want to say a desperate couple. Almost all of my patients are desperate to have pregnancy. That's why they come to me, right? I'm going to say
I
this
think I
again.
know this story.
We're the most pro-life field there is. I mean, if somebody's pro-life, they should say, "Hey, let's train more reproductive endocrinologists, and IVF experts, etc." If you're really pro-life. But anyway, I had a woman, and she's pregnant. It looked good, and then around 8, 10 weeks, I forget. It really doesn't matter. 10, 12 weeks. the fetus was clearly abnormal. It was clearly not growing properly. And these sonograms are pretty accurate. And after a couple of weeks, it was clear that this fetus was called amorphous. It was not a normal shape. It was clearly incompatible with life. You could tell the couple with absolute certainty this pregnancy is not viable. This I don't know what to call it. This gestation is not going to make a baby. Make a dead baby. It's going to result in a tragedy. I don't want to sound insensitive. At some point, you have to say, look, this is not going to end well. And there was nothing I could do but give her information. It's a small world. I don't want to say too much, but she went to another state, took care of it. And in fact, at that other state, when they tested what are called the products of conception, it had a genetic problem. It had abnormal chromosomes that were absolutely 100% incompatible with life. So our diagnosis was correct. Yet her treatment options here in Missouri were
none.
We're limited, and that added to her stress. By the way, she has since become pregnant with a healthy pregnancy, and I think is almost ready to deliver a healthy baby, which is what we all want, you know. So anyway, so there's another personal experience here where I wish the law were more expansive or understanding or flexible enough to let us do our jobs. My patient doesn't have to go to another state.
Well, some patients can't afford. Well, they probably wouldn't be coming to you if they couldn't afford.
No, not everything we do is super expensive, and sometimes they have just enough to get pregnant. Their insurance covers just enough.
And you do the radio thing. Don't you give away a baby?
It's something that we do. My practice gives back to the community. We do something called Gift of Family. I think we've done it for 5 or 6 years now. And we have couples who need in vitro, who probably need in vitro fertilization, and they can't afford it. And they write an essay explaining their situation, and then the staff at the radio station goes through them, and they pick, and then we find the couple that we hope is most deserving. And so we give away. Now this is I don't know any other practice in the country that does what we do.
That is really cool.
Yeah, we get to gift, we give back to the communities, but that's just one person, one couple maybe. And the need for the people that need IVF and can't afford it is in the thousands. So we do what we can, one
starfish at a time, right?
That's right, one at a time. Yeah.
Well, not every fertility doctor has their own YouTube show with over how many subscribers?
That's right.
My podcast today just crossed 140,000 subscribers. Yeah.
That's fantastic. Wow, it's really taken off.
In the mail, and tomorrow I'm supposed to receive my silver button. They give you a plaque with the silver button when you crack 100,000 subscribers. So, yeah, and it's a thing. I don't know if you know, it's a thing. The unwrapping of your button is a thing. So we're gonna have an unwrapping.
Can't wait to peep that.
Yeah, that'll be a lot. But yeah, I'm looking forward to that.
Cool.
It's coming soon.
Yeah. And your show's great. You've had so many cool, great guests on there. It's wonderful.
Well, thank you, Lisa. I had Dr. Lisa Rollison, in fact, the general surgeon, and she talked about hernias and gallbladders, because I don't know if your audience knows that Dr. Rollison does 1,000 gallbladders every day.
Every
She's the
day.
most prolific, efficient surgeon I've ever met in my life. So let me see here. So if I go to, I'm going to the Dr. Gil show right now, and it looks like Dr. Rollison has had 16,000 views.
Wow.
Yes, Queen.
Yeah,
that is something. Wow.
Good interview.
It gives me a little anxiety, I got to tell you, but I'm happy. That's fantastic.
Yeah, and it'll only increase. These things tend to snowball.
Awesome. Well, tell everybody where they can find you, Dr. Gil.
Sure. my practice, my fertility practice is called Missouri Fertility, and it's MissouriFertility.com. And our YouTube channel is called Missouri Fertility. We have lots of helpful educational videos and all kinds of aspects of infertility. And my phone number's there, and then people can call for an appointment. We are very, very busy. So if you have any question about your fertility, call and get an appointment, because it may be a month or 2 or 3 till you can get in. So it doesn't hurt to
Yeah.
get
And
in line.
it never hurts to have that conversation, right? Even if you're not sure about your own personal circumstances.
I would advocate that couples, even considering having children, at least be evaluated. Just some basic things like an ultrasound, some hormone tests, a semen analysis, just these basic things, so you can kind of plan your family without just necessarily guessing and hoping it's going to happen
Right.
like you want it to happen.
That's good advice. Yeah.
Yeah, my podcast is called The Dr. Gil Show, and the address is DRGILMD, all one word, Dr. Gil. Now, there's other Dr. Gils with 2 L's. It's DRGILMD, and
it's
that's for my podcast.
discussing medical matters that matter to you. Is that how it goes?
All medical matters. I've got a great smorgasbord of experts. But what I think makes my podcast special is every person I interview is an absolute expert, certified, the best, some of the best in the world, or some of the best in the world at what they do. So what you get on the podcast is very accurate information that you can rely on.
Dr. Gil, love it. Well, thank you so much. I really appreciate it.
Well, I appreciate
thanks
you
for your
bringing up
time.
this. It's a very sensitive subject, and I want to say one more time for our audience, we are as pro-life as you can be. Okay, we help desperate people get
That's
pregnant and have babies. That is what we do, and
Every day.
If people can be every day, and if people can be sensitive to these difficulties and nuances that are inherently involved in human reproduction, and just give us some space to do what we want to do. We are ethical. We have morals. We have standards of care, best practices, ethical statements that come from our various organizations that are very carefully thought out by experts and lawyers and ethicists and all this kind of stuff. So we work to the highest standards to bring the best care to the women and the couples we treat.
Well, thank you for doing what you do. We appreciate you.
Thank you for your time, and thanks for having me on. I really appreciate you.
Of course. Well, you have a great night, and we'll see you around.
Thank you. I'll see you around, my friends. Bye-bye.